Up to 25% of patients with cancer will develop a venous thromboembolic complication during the course of their disease. When this happens, the management of cancer-associated thrombosis is challenging because cancer patients experience a higher risk of recurrent thrombosis and major bleeding than do patients without cancer who are on anticoagulation. My name is Harry Fuentes, and I'm a second-year hematology-oncology fellow here at the Mayo Clinic.
My name is Rob McBain. I'm one of the vascular consultants at the Mayo Clinic in Rochester, Minnesota.
In our study entitled Direct Oral Factors 10A Inhibitor for the Treatment of Acute Cancer-Associated Venous Thromboembolism, a systematic review and a meta-analysis, low molecular weight heparin has been considered the standard of care for the management of venous thrombosis in patients with cancer. Recently, in highly selected patients, direct oral anticoagulants, also known as DOACs, have emerged as a promising alternative for the management of cancer-associated thrombosis. However, outcomes regarding safety and efficacy differs among available studies. Therefore, we designed a meta-analysis to first determine the efficacy and safety of DOACs as a class when compared to the standard of care, low molecular weight heparin, and second, and probably most important, to explore the comparative efficacy and safety of each direct oral anticoagulant and low molecular weight heparin.
This set of studies are very important because for the first time we have established the efficacy of the direct oral anticoagulants in the setting of cancer-associated thrombosis. The important hurdle, however, remains safety, and from that perspective, major bleeding is still an area of concern. And I think this study by my colleague, Dr. Fuentes, and colleagues underscores the importance of differentiating major bleeding when it comes to one direct oral anticoagulant versus another.
In our study, when we compare the effect of DOACs as a class compared to low molecular weight heparin, we were able to detect, in terms of efficacy, a reduction in the recurrence rate of venous thromboembolism in those patients who were treated with direct oral anticoagulants, but there was a higher incidence of major bleeding. When we went ahead and explored the efficacy and safety of each anticoagulant and compared to each other, again, in a highly selected group of patients, apixaban appears to be a safe and effective alternative for the management of thrombosis in patients with cancer.
There are some exciting ongoing trials which we are eagerly awaiting the results. These include the Caravaggio study and the Canvas study, both of which will assess further the efficacy and safety of direct oral anticoagulants in the acute management of venous thromboembolism. From the standpoint of long-term management, however, there still remains a data void. For example, after you have completed 6 to 12 months of anticoagulation, we still don't know what to do with these individuals long-term. There are 2 trials which we are eagerly awaiting, the EVE trial and the APICAT trial, which will help to determine the efficacy and safety for the long-term management beyond the acute setting for these class of agents in cancer-associated venous thrombosis.
In summary, we think that by providing comparative safety outcomes of these 4 individual agents, our network meta-analysis offers clinicians new insights to aid decision-making for anticoagulant choice.
We hope that you enjoy the article and find it useful in your clinical practices.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.